the title of the session? It's the art
Make sure that we're up
Art
here,
recovery.
folks. Okay, all right. We will give a few minutes here for some people to jump on. We'll do some introductions, folks, and for those that will be tuning on, make sure you share this live stream here. This is going to be a Facebook Live. If you don't have Facebook, make sure you tune in on YouTube. We are encouraging people to make sure that you give us a comment. This is the American Rescue Plan feedback form, and this was directed by the Winnebago Tribal Council to try to get some feedback for the American Rescue Plan Act that will be coming, and the funding will be coming into Winnebago. Just a few minutes here, so we'll let some more people get on. Just want to make sure that you're aware of some other events happening in Winnebago. Tonight at 6 p.m., right after this, there will be a plant medicine workshop at the new Farmers Market building, which is north of Winnebago. Make sure you attend that. There's going to be doing some whole chunk plant medicines and some of the medicines that you can grow. And so we appreciate that. At 6:30 tonight, also, there will be a homecoming celebration powwow meeting at the Winnebago Veterans Building. This is the open meeting, and as you know, save the date for July 23rd, 24th, and 25th for the Winnebago homecoming celebration. Also, the last message wanted to make mention is that tomorrow the vaccine clinic is going to be at the Winnebago Public School bus barn. Still at the school, but just note that it won't be in the gym. It's going to be at the bus barn, and we hope you folks, if you have an opportunity, and if you had not had a chance to get vaccinated, that you schedule that at 402-878-2258. All right. So, folks, we are here. We're going to do some introduction. My name is Garen Coons. I'm the Communications Director for the Winnebago Tribe. And I'll turn the microphone on over to the folks here so that they can give their introductions as well. Starting with Alan.
Hi, everybody. I'm Alan Post. I'm the Winnebago Tribe's Chief Financial Officer, or as a lot of people call me, the Money Man. I'm here to help answer the questions and take input and write notes so that as we're pulling this plan together, we can make sure that we're taking into account those things that are important, not only to the tribal government through tribal council, but also to the Winnebago people.
Good evening. My name is Billy Kitchian. I am the COVID-19 program coordinator for the Winnebago Tribe, and I'm working with all funding that has to do with the COVID-19 pandemic and just navigating through the uses.
Good evening, everyone. My name is Victoria Kitchian. I am the chair of the Winnebago Tribal Council, and I'm really happy that we're joined here tonight with our team who have been working to facilitate these projects on behalf of the tribe. Want to thank the Tribal Council for their support in having this consultation process, and that we would have an opportunity to hear straight from the membership on how we could best facilitate these projects on behalf of each of you. So thank you, Garen, for coordinating this, and with Billy and Alan's assistance, we're able to capture your input this evening. So please take time to share this, write your comments. We're going to answer questions throughout the forum, and there's also a paper survey and on Facebook. If you use the what do you call that? I don't know.
The QR code.
The QR code, and take an opportunity to have your voice heard and really help us navigate this recovery effort.
All right. And thank you for those that are tuning in. Currently, it looks like we've got about 26 people. So if you guys could help us out, I just want to make sure we're monitoring your questions and your comments. And so if you have an opportunity, give us a comment now. So if you can't hear us, we're trying to talk, but make sure that let us know. And this is kind of like the first time we're doing like this Facebook Live event as well as YouTube. So comment below. Let us know before we get into what the PowerPoint presentation is. The COVID-19 program coordinator, Billy Kitchian, is going to give us a PowerPoint. So let's see if we have any. We have one here. It says I can't hear them talk. So maybe we have to figure that out.
Okay. One thing to note, Garen, is we had a session scheduled for tomorrow evening that we're having to postpone until early next week due to a death in the community.
Correct. Let me double check to make sure that we're. How are we doing over there, Erica?
Getting audio on the YouTube over here.
All right. We appreciate that. Let's see. Looks like we have some audio over here. Sounds good, and we can hear you. So with that, we appreciate everybody's feedback on that. Like I said, this is the opportunity, and now we'll get into the presentation by Billy. We're getting up to about 35 viewers on Facebook, so make sure if you folks have an opportunity, make sure you share this on your Facebook, as well as we have 6 now watching on YouTube. So Billy, go for it.
Okay. Here's a PowerPoint that we'll go through. The first screen. Okay, so the next screen, we're just going to be going through what the ARP funding is, the eligible uses, and then we'll go through the survey as well as give you the QR code again for you to fill that out. If you want to go, okay. So what is the ARP? On May 10th, 2021, the United States Department of Treasury announced the American Rescue Plan Coronavirus State and Local Fiscal Recovery Funds. This is the same funding that we had all received a stimulus through, but there's also funding that was available to state, local, territorial, and tribal governments. So 350 billion was set aside for those governmental entities. Out of that 350 billion, 20 billion was reserved specifically for tribal governments. Out of that 20 billion, the first 1 billion was divided amongst the tribes. So each tribe received an equal dividend of that first 1 billion. For the remaining 19 billion, the Treasury had actually conducted 5 consultations with Winnebago tribal government leaders. And the Winnebago tribe was very active in each of those consultations and was able to verbally as well as formally submit their comments for how the Treasury was going to distribute the remaining 19 billion. They listened and they didn't. So the formula that the Treasury had come up with was 65% of the funding would be based on tribes certifying their tribal enrollment information. So this differs from how the CARES Act funding was received, because through the CARES Act funding, they had used our HUD numbers for that, HUD housing, local housing numbers for that. And so we did not get a full allocation that would have been appropriate for the amount of our tribal members. So that's what differs from the CARES and from the ARP funding, that we're actually using our total tribal enrollment numbers for part of the funding. The remaining 35% for each tribe will be based on their self-certified tribal enrollment data. At this time, we do not have a total of what the Winnebago tribe's allocation is, and we're just continuing to plan internally with our departments for budgets. The ARP has some key objectives here, and so the top 4 key objectives of the programming is to support urgent COVID-19 response, efforts to continue to decrease spread of the virus and bring the pandemic under control, replace lost revenue for eligible tribal governments to strengthen support for vital public services and help retain jobs, support immediate economic stabilization for household and businesses, and finally address systematic public health and economic challenges that have contributed to the unequal impact of the pandemic on certain populations. Now we'll go into the specific eligible uses that Treasury has aligned for this funding. The first would be to support the public health response. Some examples of this would be COVID-19 mitigation and contamination efforts. So in that would be more quarantine housing projects, PPE distribution, different types of those efforts, medical expenses, behavioral health care, public health and safety staff. The next would be addressing negative economic impacts. And so I think that one of the points to make between the CARES and the ARPA recovery funds is with the CARES, it was trying to respond to the pandemic as it's rolling out and trying to stop it and keep our community safe. With the ARP funds, it's more responding to the effects that the community has had and recover economically from that. So that's with this addressing negative economic impacts, we can help households and workers. A couple examples of that would be direct payments. That's something that was not allowable through the CARES Act funding, and that is allowable through the ARPA funding. Continued utility assistance, different type of assistance for our tribal members. We're still able to continue through this eligible use. Small business and industry, through the CARES Act, we were able to provide tribal member owned small businesses with grants to help assist them with lost revenue during that time. Rehiring staff. So if the tribe had to let go of staff because of economic impacted reasons or funding that we didn't have for those services, we're able to rehire those staff back. Impacted industries, those are really focused on the travel industry, the casinos, the food industries. So all of those that during the pandemic had just shut down, and many of us tribes that depend on that revenue were heavily impacted. And so trying to aid those industries in coming back up and aid the government in getting to where we can to support our tribal members. This funding allows us to replace tribal government revenue loss, and that will help us to continually provide the vital government services to our tribal members near and far. If you guys have any input, then please add.
One of the things I'd like to say, we have the allowed direct payments. Well, one of the considerations that we are trying to get an answer to on that is the income applicability. Is it taxable income for the people receiving the direct benefit? If it's income, will it potentially harm somebody who's on a fixed income? Because we don't want, if we're trying to do a good thing, to harm somebody. So we're trying to find out the answers to those. I've personally requested through Treasury an answer to that. I have not received it yet, but we're still continuing to research and find out, because to me it would be one of the worst things if we do something good and then somebody's harmed economically because, say for example, if we give them money and then they're on SSI or some other fixed income and it gets reduced because we try to do something good for them. So we're trying to find an answer to that so that we know going into anything like that we have the answers.
I'll just comment. The tribal council was very receptive to the in-person feedback, the Facebook feedback, and much of what the membership wanted to see in terms of direct payments, and especially the parameters that we were within. We did many things through head of household. And so the tribe, I want to thank Alan and the finance team for their effort to walk a straight line, and we didn't deviate from any of those guidelines, and that took discipline, and it also took telling our tribal members that wasn't allowable, and that was a hard thing to accept when they witnessed other tribes doing direct payments. So I just want to thank the Winnebago tribe for staying within the guidelines and working with the guidance that we were given from the Department of Treasury. And I'm really happy to report that I have talked to most of the council that I was able to catch up with, and are gauging their support for direct payments. And we acknowledge and understand that everyone's situation is a little bit different, and trying to design programming within guidelines and an effort to be generous with the people and understanding of their circumstances through this pandemic is the utmost importance to the council. So I want to share that and thank finance for their role in that.
Okay, so we'll go on to the next slide. The fourth eligible use we have is to provide premium pay for essential employees. With the CARES Act, we were able to provide has additional percentage of hazard pay for employees that were reporting to the office during the pandemic. The ARP funding gives us some more specific guideline for who the essential employees are. So it's regular in-person employees that perform regular in-person interaction or physical handling of items that were also handled by others. So through this, then internally through the HR and the other directors, they will figure out what positions meet this eligible use.
Then the next one I think is a huge impact for the tribe is investment in water, sewer, broadband infrastructure. That's something that's very new on here, and then the being broadband being considered infrastructure is new, at least in my experience, in this situation where we can improve the water and sewer infrastructure. We can make things better for the long term. Um, and then also one of the things that everybody found out um, over this last year was broadband is huge, and if you don't have access to it or limited access to it, it potentially can limit your the kids' ability for schooling and health, a lot of the healthcare things. So I think this is one of the big portions of the ARPA funds, and that we're making sure that we look at these eligible uses and that we're planning and taking into account what is eligible, because we don't want to ever be in a position where we spend things incorrectly.
I'll comment on that. One of the things that I've learned from other tribal leaders and from some of the national Indian organizations that the tribe has had relationships with, they say that when the United States government set up public health infrastructure in the 1950s, they left out Indian country. And so you can imagine and know what our roads look like and what we lack, these certain buildings and certain services that you would think would be standard and there would be equity across the country in some of that infrastructure. And so when the pandemic hit, Indian country was that much less prepared to respond to that pandemic without the public health infrastructure and many of the things that we might not even think are part of that infrastructure, like adequate roads so that emergency personnel can respond, and clean drinking water so that our tribal members and families that fall ill have the basic necessities that we need to thrive and be healthy in our community. So looking at some of those funding opportunities and how we can merge that with our needs is going to push us forward 10 years, overnight. And we're really excited and prepared to make improvements in town so that we don't lack the capabilities to respond to protect our tribe.
Yeah, definitely. Thank you, for this PowerPoint presentation. We still have some ways to go. Just kind of wanted to interject, and we do have some comments that are coming in, and so we appreciate that. And then our numbers are still going up. About 45 people are tuning in, but somebody said earlier we have over 5,000 members, and today's forum, to have it virtually, we're trying to reach those that are off reservation to necessarily get their input. And last night we had a great turnout. We had a good dialogue with some of the tribal members that came in. And so if you have an opportunity, make sure you folks share, and don't be shy. Make sure you comment. If you don't feel comfortable commenting on this social media, you can go to YouTube, or Billy will also have her contact information. You can give her an email. So we'll get back into the presentation. Billy.
Okay, so yes, the infrastructure is a big portion of it, and through the ARP funding, there is also other funding opportunities for other departments that are kind of coming down and shifting through. So we're going to be able to cover a lot of our in-town infrastructure through those. The next set of allowable uses are more specific to tribal governments, and give us a little more flexibility, actually a lot more flexibility, and how we're able to utilize these funds. So through the addressing health disparities, that's focusing on community health workers and public benefit navigators, community lead paint and other lead hazards, and community violence prevention and intervention. The next is investing in building housing and communities, support individuals experiencing homelessness, affordable housing development, or housing vouchers, residential counseling, navigation assistance. The third is address educational disparities, new or expand early learning services, expand resources to school districts, educational services such as tutoring and after-school programs. Just as an example, through the CARES Act funding, we were able to give the educational institutions in town a sub-award to help with any gaps that they had with their COVID-19 funding that they received at this school. So we were able to help with PPE. We were able to help with purchase some of the laptops that the school had for the students to do their remote learning. So there are just various projects within that. Promote healthy childhood environments. So to expand quality childcare, increase home visiting programs, and enhance child welfare services. So in all of those eligible uses, our tribal programs are navigating through that and kind of getting budgets together and projects together to align with all of these eligible uses. I just wanted to show you the survey as it is. So there's a QR code and a Survey Monkey link to take you to this survey. We're really steering everybody towards the Survey Monkey link so that we're able to pull the reports and get exactly verbatim how you want to express your suggestions for this funding. So we can just go through the questions quickly. The first question is just identifying if you're an enrolled tribal member living on the reservation or off the reservation. The second is just to distinguish the age groups for the answers. Third, if you are living out of state, please just put your state on there so that'll give us a good navigation of that. Fourth is, what do you need during the pandemic to feel safe and take care of yourself and your family? And there are some options there. 5, during the last year of the pandemic, what was your biggest challenge? So in answering these questions and really giving feedback, you'll let us know really what our tribal membership is in need of during this time. The 6th question is, if you have barriers to accessing reliable internet, what are those barriers? Do you not have internet? Do you not have a device to navigate those? Or do you live in a location where you just can't get good internet? Here in Winnebago, we do still have connectivity issues. And one of the things with the infrastructure, the broadband infrastructure that's specific, is increasing the up and the down
Download and
downloads.
the
Yeah.
upload.
So I had to learn the difference of that, the upload and download, but you need both of them to be efficient and fast for the schoolwork and homework. So in the last year, has COVID-19, as of March 2020 or later, impacted your household income? Have you had your utilities shut off during the pandemic, possibly due to an interruption in your household income? And for questions 9 and 10, we're asking for you to rank them on what you think the highest priority of them should be. So 8,
And just to interject, you don't have to worry about trying to do the numbers on each one. If you can move them up and down, and it automatically numbers them where you want them.
Yep, so you could just kind of click on economic support and shoot that right to the top if that's what it, so you could visually see it kind of moving around, which is helpful. So 9 is kind of like has those ranking, and 10 is more focused on different construction projects that have been discussed or have just been mentioned through community involvement and conversations. So there are some there. But if you have other ones that you would like that aren't listed there, that's where you have your option 12 for. So that option is for you to feel free on letting us know what types of projects you think would benefit the tribal membership. And I skipped 11, but 11 is just this to let us know how you're obtaining all of the information that we're sharing regarding the pandemic or any other tribal issues.
Definitely. I think last night there was a question from one of the tribal members said, how you plan on reaching everybody? And that's kind of like the unicorn question that we're trying to get across. And so that your feedback is very valuable to all the tribal members. So make sure that if you have a few minutes, there's 13 questions there, or 12 questions. And I think that last one there, Billy, if you kind of want to talk about that last question, that would definitely help us out. If they want to give us a piece of their mind, that's the
Yeah, lay it
opportunity.
on me. Just kidding. Nope, there's actually not a limit there. So the limit is infinity. But you know, if you want to list there, if you'd like to just let us know how the CARES Act project helped you, didn't help you, how you your suggestions on how this one could work better. That is number 12 is your area to let the Winnebago Tribal Task Force and the Winnebago Tribal Council all know what your needs are.
Definitely. And right now we got about 47. We're hovering around that, folks. So if we can get some more people to tune in, maybe share this link. And like Tori was mentioning, direct payments to tribal members. What do you think that amount should be? Maybe comment into that section on what would help you to get through this pandemic and stuff. So definitely keep sharing. And Billy, if you have contact information.
So this last slide has the QR code that you're able to fill out the survey directly. I know underneath this link or somewhere there should be a link directly to the SurveyMonkey one if you're having trouble scanning the code. As of this morning, we had 119 survey submissions, which is about 2% of our total tribal enrollment. So this is our time to voice our concerns, opinions, our needs, our wants. So I really encourage us all to get onto the SurveyMonkey. We will be working with the Winnebago Senior Citizen Center to work with the seniors in town that do not utilize social media or have smartphones to do the survey. So we will be working with them and be able to get their direct input as well.
And Garen, this information will also be in the WIN.
Right. The Winnebago in the News actually has an issue coming out on Saturday. And so they'll be in your mailbox. And then for the out of town people, they'll be hitting their mailbox on Monday or Tuesday. All righty. So are we ready for some comments, some feedback, and some questions?
Yes.
Okay. So here's one from a tribal member. I believe this gentleman lives in Sioux City. Are any of the current summer programs going to be run on COVID funds? So the summer programming now, is there anything for the COVID funds this summer?
I'm not 100% sure because, you know, as we've said, we are in the process of pulling all the ideas together and using, you know, the funds where it can be used. If we are able to do any of the summer programs using these funds, then we most certainly will. My theory is use somebody else's money, like the federal government's, before we use ours.
Correct. That's awesome. Thank you for that response there.
So with another thing with this money, so with the CARES money, we're kind of wrapping that up because we had gotten an extension on that, but this money we're able to use from March 1st, 2021 forward. So any summer,
Could be this summer, could be next summer. It just depends on the usage and what we come up with, with these forums, with our tribal departments pulling together, with the task force pulling together, with council's input, putting together, the budget, and use the budget as the, for the numbers, that's true, but it's also that budget drives the programs.
I guess that's a question of mine that I would ask you guys. What's the kind of date on the American Rescue Plan? When has it got to be done by? Because I know the coronavirus, there was some determination, got to be
Yes.
spend it by December, and then they came back and said, well, you get an extension. So,
Yeah, that was a fun time at the end of 20. They had, we were supposed to, the CARES Act, it was, as you said, it was supposed to be all funded or all spent by December 30th, 2020. Then on the 27th, they finally came out and said, oh no, well, now we give you another year. And I'll say I aged about 5 years in those few days. But we have until December 31st, 2021 to expend all of the CARES Act dollars. We're on track to have those all done prior. The ARPA funds, what they have said is we have to have the funds obligated, not spent, obligated, like a contract or a PO or whatever, by December 31st, 2024. Then we have until December 31st, 2026 to have these funds fully expended. So we have a little bit of time. It's not like we're gonna, like the CARES Act, where we're under the gun to get things done quickly. We want to do this deliberately and with good thought and do things in a good way.
right. And I know that they formed the COVID pandemic task force that took recommendations to the council, and the council had the ultimate authority to do that. But
Yes.
I guess the here's a question for Tori. They're talking about you couldn't correct those initial numbers that were based on the local HUD data. Other tribes filed suit to correct the numbers to reflect actual enrollment numbers. Can you tell us kind of like how they come up with the formula for American Rescue Plan?
So I think they're talking about some of the CARES Act money. And so what had happened was, since the CARES Act money, one of the factors in the formula was the HUD census data, and some tribes had 0 HUD units on their reservation, so they got 0 money. And the one gentleman on one of the consultations, he said, I'm not a 0, my people aren't a 0. And so those are the tribes that got supplemental funding, because under that former calculation, they did not receive any distributions. And so since we did receive a distribution, and under that calculation, that's what we got for that.
Thank you for that answer. Here's a small business owner. It says that he's owned his taxi service business for 3 years now. His taxi service was severely impacted by COVID, and was inquiring about if they're going to do another round of small business grants to those businesses that have been impacted. I think that will be under consideration. I don't know if Billy or Ellen want to comment on it.
I can comment on that. I know that the small business program is, we're considering it, we're talking about it, and trying to figure out how is the best way that we can pull something for the small business owners into the program. So we are considering it. I can't say definitively yes or no because we're not that far yet.
Definitely. So make sure you fill out the survey to give us that feedback.
Correct.
Absolutely.
The local broadband here in Winnebago is very subpar. The speed that they're offering is crawling slow. Just to get fast doors, would we be able to maybe put that on the project?
Actually, I'll talk to that one. That broadband is one of the projects that we have at the top of the list. Not only through these funds, we had some work that was through the CARES Act, but there's also some other funding that is becoming available through infrastructure broadband programs or bills in Congress. And also there's a very specific one that is for broadband that we're working on getting funding for. So we are working on it. We're trying to make it better for the community.
Awesome. And so here we come to the question. One of the reasons we're having this is try to get some input from those that are living off the reservation that are still tribal members. They said, please don't forget about those living off reservation. Still, they're counted in the tribal census when applying for grants, etc. I just wanted to make that comment. And then another comment about off reservation is that we should plan to help some of the people off reservation. Is there a plan for that?
So, in response to that, and thank you for raising those comments, and to the tribal members that raised that, it, the limitation that we had during the CARES round of funding was that we were trying to design programming that would, I guess, have the most benefit, and with limited resources, I think the budgets that came together offered programming that was on the reservation in the form of some of the food distribution. We had some of the just some of the outreach was on the reservation. I think we really heard it when we did the freezer distribution and the meat bundles, and quite frankly, there just wasn't enough to reach our total membership, and it's because we didn't receive funding comparable to our total membership. And so the council definitely carried the weight of some of that decision making, knowing that those dollars would only reach so far. And so when we engaged in the consultation process, one of the top priorities that I brought to that discussion was, why can't tribal governments give direct distributions to their tribal members, and tribal citizens and tribal governments should be able to design programs that fit the needs of their tribe, and not having that flexibility was not a fulfillment of the trust responsibility and the right for tribes to govern themselves. So I'm kind of going off on a tangent here, but I want you to know that we take it very seriously, that that we're looking out for all our tribal members. And so with that, we're hoping that we can come up with an allocation that would be respectful to the membership, and that it would go to every enrolled tribal member, where no matter where they live, and that we would have opportunity to put something in for the children that haven't had distributions. And so we're working through all that right now, and through Alan's leadership, we're making sure that those that are on fixed incomes would not be harmed by any of those direct distributions. So I just want to share with those relatives that are making those comments that we have not forgotten about you, and we're putting the people at the forefront with these discussions.
Thank you for that response there. So I think that too, maybe some more explanation here, and that's why we're here, is to learn more about it. But one of the questions is, would there be any funds allocated to domestic violence, mental health, or sexual assault prevention that has been perpetrated by the pandemic? And I know that I believe the Winnebago Comprehensive Healthcare System did get an allocation. And then there's also another comment here that says he filled out the survey, and he forgot to mention and put on the survey that will there be any funding made available for Rolling Thunder so that they can hire staff to have the community pool open during the evenings and the weekend?
And you touched on it, Garen, that the Winnebago Comprehensive Healthcare System did receive allocation through IHS in response as part of the ARPA funds. So with Whirling Thunder and the pool, that is part of their programming, and so I can't speak directly if we're able to do that, but it is a consideration, and we're keeping that in mind. And as far as like the domestic violence programs, and that is all part of the allowable uses, as you saw. So those type of initiatives we definitely will keep at the forefront of our thoughts and our planning.
Definitely. Just a comment here, or actually a question. When you mention assistance to tribal members, does that include under age 18 off reservation members?
Yes, I had the treasurer Rona Steeler and I have been in discussion almost on a regular basis with Alan as we learn more information. And one of the things that we said was that we just acknowledged that the tribe has not been able to give distributions to tribal members and our minors for some time now. And I think even before the pandemic, the tribe was in a bit of a recovery period, but we've had clean audits, we've taken over a hospital, we've brought on more leaders, new tribal leaders, and we're transitioning out of a bad space. And and I think we have the membership and the tribal leadership to thank for that support. And as we endeavor forward.
Definitely, definitely. So Billy, I guess some of the things that maybe the tribe is looking forward to, maybe I I know that the process of getting the budget passed has, and there's some deadlines that are still to be met yet by the finance office and stuff. But what are some of the maybe the projects that would be good for this round, and kind of the mentality that maybe some of the tribal members should be thinking of that would be good to kind of mention?
Well, I think that we all need to just take into account how the pandemic has affected us, our household, and our families. I mean, that's where the bulk of how you'll see and be able to answer. Um, I would think myself, I think if I had some more PPE, that would have helped our family during that time, just because it was so hard getting a hold of certain things. Um, I think some more vaccination efforts to be put forth. Um, the tribe just has a lot of projects on the table already.
And then, so I guess that the next question is, maybe Alan or Tori, what's the process like? Have you guys decided on, you're going to take some of the survey feedback, kind of put it?
Well, the process one, we're going to take this feedback and we're going to, use it, consider, and thoughtfully consider it. We're taking feedback from our departments on their needs and how they can use this. And then what we have done, what we'll do is we'll pull these projects together, come up with a budget for the projects. The task force will discuss and consider and have input, and then the final say will be presenting this project to the tribal council for their ultimate approval or changing or whatever council will do. The ultimate authority for approval is with council.
I'd like to comment on that.
Sure.
It's definitely a shared governance model. We've started with our programs, as Alan mentioned, and the program started putting together, we called them wish lists, but really they were lists that programs put together that would enhance services to tribal members or enhance, you know, operations in some way. And so as these budgets, I guess, come to fruition, this process that we're undergoing right now is the tribal member input, and the task force that the tribal council has initiated, last year, has a role in this. And so it'll go through all those levels before it comes back to the council. But each of your input, I encourage you to continue to reach out to each of the tribal council members that you have contact with, or would like to email us directly. And we really want to hear from you so that this is guided by community and not by, maybe some of our individual thoughts. I said yesterday in the live, I said, well, I'll just tell you guys that the two things that I really want are direct payments to tribal members and a Boys and Girls Club. But it's not what I want, it's what the people want. And so we hope to capture that this evening and over the course of this survey process.
Definitely. And there was a comment there. It says, I think it's great that we are getting community input on where the funds should be spent. However, I'm wondering what our leadership, tribal council, thinks about where the funds should be used. And so appreciate that comment, and just kind of something for consideration there. Another comment here is that I think this one's related to the utility assistance, and that's a whole nother, that's CARES Act. So right now we're working towards the American Rescue Plan. So
Correct.
I think Billy mentioned it in last night, is that we're trying to focus on the future here to make sure that we get this community input. CARES Act came fast, and we had to get it spent, and we did some great projects. I know that we put up the LED screen downtown as far as communication wise and stuff. And one of the things that we put in for communications was that every tribal member off and on reservation would get a subscription for the Winnebago Indian News. Due to the heavy postage and everything, that we weren't able to get everybody a subscription, but everybody's subscription would be paid for a year. So that's kind of some of the, that's what we put. Would it be funded? That's up to the council and to the pandemic task force, but
Right.
I don't want to throw that out there.
I can tell you that one's still on the list, but we're, it's a process that we have to go through, um, careful consideration and what is going to be, and to use somebody else's term, the best bang for the buck. We want to do something that's going to have lasting impact on the community and the tribal members, and taking into consideration those things that are needed. Um, I was trying to, I lost where I was thinking, but um, you know, th- to know that this process isn't in a vacuum. We seek input from community members, as we have here. We seek input from the council, so that what we present is a good thing. We don't want to spend any of the money frivolously. We don't want to spend it on things that we can't. We want to do this in what's good, and that's where I keep my focus, is what is good for the tribe and for the community.
Definitely, definitely. And then, so some of the comments that are coming in now, we appreciate everybody that's commenting. Make sure that you give us your feedback. A dialysis unit was mentioned on the survey. How realistic is that?
I don't know.
It's possible.
Mm-hmm.
I don't know how realistic it is, but I know that it is high on the list of priorities at WCHS and the hospital, to try and get that unit into place. Can I say it will definitely happen? No, it's too early for me to say something like that, but I think it has potential and it is possible, but we'll see what happens with all the projects and the funding.
I can just make a general comment on that. There are many things that a lot of the membership over time and the tribal leaders have had, we really need a dialysis unit, or we really need Boys and Girls Club, we really need a new tribal building, we really need a assisted living. There's all these bricks and mortar projects that the tribe just has I don't want to say put on the back burner, because it comes down to resources and what's the tribe's able to do. And I think another part of that same discussion is operations. It's one thing to build a building, and it's another thing to take on the operations of that. So but going back to the dialysis unit, the council and the WCHS board of directors have had continued conversation on that, and the question has been, well, our neighbors to the south, the Omaha Nation, they have dialysis. Why don't we have that? And so we've definitely explored that. We've talked about it at the board level, and that conversation is still moving along. So
We have a comment here. It says direct payments are the only way to really equally distribute to members who live off the reservation. No one really has the same needs, especially off reservation. So that's just a general comment there. And we also have another comment. Like to see off reservation programs, especially those that are offered by the tribal government, equal to every tribal member. Mentioning kind of like food distribution and some other things in medical as well. So that's something that we can work towards. I know that the survey is the big thing that we're trying to promote here tonight, is to make sure that you folks take the survey, tell your friends, tell your elders, Choka and Gaga, to make sure that they fill it out if they have the opportunity. And if you have an opportunity, make sure you email Billy Kitchian, who's the COVID-19 program coordinator. And her phone number for regular business hours is 402-878-2272. And Billy Kitchian, Kitchian at winnebagotribe.com to give her more feedback. So with the survey, Billy, I think that you can only fill it out one time, basically.
Yes, it does have a control on there where one IP address can submit one survey. So I don't know if that would cause a problem if you have one phone or one computer for one family. If that is your case, then I would just email me, and then we could figure out a path to get everybody's feedback there.
Here's another question. Is there a need for a new healthcare facilities? I was wondering why that was an option on the survey. I guess maybe kind of develop how we developed the survey.
When I developed the survey, it was based on and just plugging in just things that were coming in on the wish list. So some of them, like the dialysis clinic, have been a need for the community for a period of time. So with these fundings coming, some of these things might be a reality. So not all of the projects on there are 100% a go. They're just things to guide and frame our, I guess, our minds on what could be some possibilities. So not all those are for sures. They're just things that we need in our community.
Awesome. All right. Well, we got about 9 minutes left here, and I know that some of us want to get to the Powwow committee meeting. That's it's going to be tonight at 6:30 at the Vets Building, and then they also have the Ho Chunk plants over at the farmers market. A lot of events happening. Tomorrow's event for the evening is going to be postponed. We have a tribal member that's going to come back about 4 o'clock tomorrow, but the CEO report is going to happen tomorrow during the daytime, 10 a.m. And then just so everybody knows on kind of some of the schedule on that. But let's see here. How can we find out how many times those tiny houses that Wildlife and Parks owned was used for COVID? I believe Mona addressed that in one of our COVID-19 updates, and she does have the numbers. And
Right.
so the Winnebago Public Health Department takes care of those, and we appreciate all their help for doing that. I know that they ran and got supplies for those that had COVID when we were right in the middle of the pandemic, and a lot of hard work. So we appreciate the CHRs and the EMT and the Public Health Department for all the work that they've been doing, and especially with the vaccines. I guess some good news that came from Denal, if you want to mention that, Tori, this past Saturday.
Yeah, this weekend we got an email from Danelle, and we get an email very often on the regular basis. And we have 0 current cases of COVID, and we have 0 houses on quarantine right now. And I want to thank all our team over there at 12 Clans Unity Hospital, our public health, Winnebago Public Health Department, that have all hands on deck fighting this pandemic, and our community, hand in hand, doing what we can, getting vaccinated, socially distancing, every recommendation from the CDC that the tribe is taking seriously. I just want to thank everyone for your role that you have in protecting your family and the future of our tribe. And so please, if you are not already vaccinated, please consider getting vaccinated as the studies and the science unfolds, and our youth have gained access 12 and up. Just please take the time to educate yourself and consider protecting yourself with the only tool that we have right now. So
Thank you. Here's a question. Is it possible to start the discussion for a new building for the Boys and Girls Club? Today we had close to 80 kids, and the building size and space is obviously an issue within the community. Is it possible to have our kids 6 feet apart in a facility that small? So just kind of, I think Tori did mention that that was one of her things that she would advocate for.
So, when each of us get on the council, we have different things that we want to impact. We have talking points we bring to the table, and change we want to affect. And one of the things that is always a high priority are our elders and our youth. And we both, or not we both, no, we're very thankful to have a Boys and Girls Club chapter in our community, but their needs and the children that use that facility have outgrown their infrastructure. And we were talking and kind of laughing about remembering when each of us used to go there, and when it used to be called the YDC.
Yeah.
And
My first dance was there.
and so many of us, spent time in that building, and it's time for them to continue to grow that program. And I think the Winnebago tribe has an opportunity now. And of course, this is all, contingent upon how the budget shapes up and how the people rate some of these projects. But I just want to share with you that the council does consider those things high priority.
And I can speak to that. That building is on the wish list coming from the Boys and Girls Club, so it is in there for consideration.
Awesome. Thank you. And we got some comments here. Good news about the zero cases. Willie Bass wanted to make mention that wanted to thank Billy, Tori, and Alan for helping and for leading this effort. And so make sure you folks fill out the survey. Tell your friends, tell your family members to make sure. And that survey is going to close when, Billy?
We talked about it closing on Wednesday evening to allow for more time for this dialogue to continue within our community, near and far, and so that we can reschedule our next in person. And we're looking at Monday or Tuesday for that time.
Okay. Probably one of the last questions we'll take here is, does anybody have an estimate on how much the Winnebago tribe will be getting?
We'll pitch that to Alan. We've been crunching numbers, but they are all estimates. But
We're crunching numbers. We're making guesses. I'm hesitant to say the number just because it's a guess.
Mhm.
We don't have final numbers. Still waiting on information from Treasury. I can safely say that it's more than what we got for the CARES Act.
Definitely. And then how do we plan on kind of distributing that to the membership once that number comes in?
Once we come up with the plan, I'm sure that just like we did with the CARES Act, we'll do an article in the Win on what the projects are and what we're doing.
Definitely.
We want to keep the membership up to date on what's going on.
All righty. So we just had one question from the YouTube, and we had about 18 people watching on YouTube, which is kind of surprising. Sometimes a lot of people join us on YouTube, but they just wanted to know what's the link. So we added the link in the comments below, so make sure that it goes directly to the survey. And with that, we thank Alan for your time here tonight. I know Alan has to get to the Powwow Committee meeting. And Billy, we appreciate you, and we have your contact information. And Madam Chair, we appreciate you for joining us here for this evening. And I'm sure early next week will be that last one that we're going to have in the evening time for those that want to attend and give their feedback on that as well.
And thank you for everybody's impact. Thank you for your comments that you've got on the survey, and those that we want your input. Is we're not going to do like what we joke about what the feds do. They take the comments and then do what they want. We want the input so that we can put these programs together, put this budget together, so it is an impact and a good thing for the tribal members.
Awesome. All right. You folks have a good evening. Stay hydrated and make sure you check on the four-legged relatives as well as our elderly, especially as the temperatures rise over this weekend. And today was very hot and stuff. So make sure you folks stay hydrated, and we'll see you guys down the line. You guys have a good night. Thank you.
Good night. Thank you.
Good night.